I'm going to, Sue is a dear, dear friend of mine. She is the head of our Nursing Advisory Board. She co-chairs with Lorraine Drapick. Sue and I have fought this battle together for a long time. I'm going to let her tell you just a little bit about her story and then some of the amazing work that they're doing, and I hope they're going to tell you about some of the accolades of the Nursing Advisory Board. This is an amazing group. They're doing everything they can to help local nursing groups help you, help those patients. So.
Well, thank you very much. As Stacy said, I'm Susan Acquisto, and this is Lorraine Drapick, and we chair the Nursing Advisory Board for the Cholangiocarcinoma Foundation. Stacy and I collaborate a lot, as well as I'm also the co-founder of the Bili Project Foundation, where we fund research for the hepatobiliary cancers, bile duct, liver, and gallbladder cancers. So the whole mission of our Nursing Advisory Board was certainly to advance the scientific knowledge of our colleagues, our healthcare professional colleagues at the community level as well as the institutional level for the advancement of care for our patients, and to have our nursing staff and nursing around the world be able to competently and confidently care for our patients with cholangiocarcinoma. Today, though, we have a guideline that we have developed, and part of our board has developed clinical nursing practice guidelines, which we've actually published and presented all over the world, in Asia, in Europe, throughout the United States at various associations and organizations. So we are going to first have Lorraine talk about the quick survey that we're going to have you take. Is really kind of our test, if you will, not a real test for you, but a test for us with respect to how effective this guideline will be for our nurses to teach the patients. It's just very simple, so I'll have Lorraine speak to you about that. And Lorraine, if you could please tell them where you're from.
Hi, I'm Lorraine Drapeck. I'm a nurse practitioner from Massachusetts General Hospital in Boston. I work with GI cancers and radiation oncology. Sue and I and members of our board have really worked hard on establishing guidelines, and we've recently worked really hard on this cholangitis guideline. What you're going to have, you're getting 2 pieces of paper. It's very important. Please listen closely. They're of different colors. One of them, the yellow piece of paper, is a pre-survey. We're going to ask you to complete that survey when you get it, as we're talking. And what this relates to is cholangitis and signs and symptoms. We're then going to do a quick education initiative based on our guideline for you. So this is really for you to help us to determine if this is effective and if this is something that you believe is worthwhile. It's only going to take a few minutes to do the education. We will not keep you long. And at the end, we're going to ask you to complete the green piece of paper, which is of the same questions. This is for patients and caregivers. So if you're a oncologist, we're going to ask you not to complete the surveys unless you're the relative of a patient. So if you could please start completing the surveys. We'll give you a minute to do that, and then we'll go on to our education.
Thank you. We greatly appreciate your cooperation with us. Is there? Okay, so we'll go ahead and get started. Just need to see how we're going to advance the slides here. This is our, oh, shit. Oh, okay. So acute cholangitis. Really, this is an important infection for our patients with cholangiocarcinoma to know about. And if you've not heard it before, we really want to be able to give this, and this was the whole purpose of our guideline, was to educate patients and nurses to be able to also establish a patient education information for nurses and physicians to give to their patients. And what acute cholangitis is, it's a bacterial infection of the biliary tree, and it's most commonly caused from a gallstone, cancer, or a stricture. So the two hallmarks of cholangitis are an obstruction and infection. Those two conditions occur for a cholangitis to be present. It is a very serious infection. It can put you in the hospital very quickly, and it can be fatal. It actually can be the cause of death more than the cancer itself. So cholangitis is an important infection for you to know the early signs and symptoms of, so that if indeed you had these signs and symptoms, you could get immediate attention. The hallmark symptoms, signs and symptoms of this is called the Charcot triad. And it is described as what you'll have: right upper quadrant pain, you'll have fever that is usually accompanied with shaking chills. So that you're shaking that you cannot, you cannot stop. And jaundice, either a darkening of the skin or a darker urine. Here.
You don't have to have all of these symptoms. You can have one. And it's just awareness, and it's particularly fever. If you have a fever greater than like 100.5 or 100.1, 100 or 101, you should always call your oncologist, because there is a risk of this. So you don't have to have all of these symptoms together. This is just a triad that's typically seen, that a physician or your healthcare provider would think of cholangitis as part of the diagnostic workup.
We're doing a duo here. Doing a tag team. Yes, as I value Lorraine's feedback as a nurse practitioner. She's in there caring for our patients every single day. All right. The clinical presentation, this is what nurses and what you would experience that we would be looking for as an assessment of you. We do find that 80% of the patients presented with fever, and usually greater than 100.4. Many of you may run a low temperature after you receive chemo, so it is important to know what your own temperature ranges are, and especially if you have a little fever after your chemo, what's abnormal for you? So is this a higher temperature than you usually have? 80% of the patients also complained of right upper quadrant pain, and with 60 to 70% presenting with abdominal pain and jaundice. They also, on occasion, as you see, 10 to 20% of the time, what they called altered mental status. Go ahead.
I wish I had one of the handheld mics so I could jump in. But altered mental status, and what we mean by that, it may be that you're just a little bit off. It may be that you're a little bit confused, or you're kind of hazy on what you remember and not remember, in terms of, it doesn't mean, oh, thanks. She's on blue. Thanks. It doesn't mean that there's any type of craziness or anything like that. It's just symptoms that your family might know, or providers might know. Gee, you seem a little off in your mental status. It is another sign.
The additional is that you would present with a low blood pressure. Your blood pressure would be a lot lower than it normally is, but this occurs about 30% of the time. We also look at the lab work on your white blood cell count. Now, many of you probably know your own normals for your lab. It may be a bit abnormal, the lab results, but you know your normals. So it's important for you to be aware. Many of the patients we do talk to know their own normals, and so would know whether or not their white blood count is elevated or their C-reactive protein. A lot of you know your liver function tests. It's amazing when we're talking to patients. They know what the levels of their liver function tests are. And it seems like you're thinking, well, gee, I'm not going to be walking in and telling them what my liver function tests are. But we tell you this because what we find is that if indeed you're traveling or you're not in your own, where your provider is, this is why we felt this was important, because if you're traveling and you're not in an organization that's usually treating you and you end up going to the emergency department or another hospital, They may think that the elevation of your liver function test is just a progression of your disease or because you have it. If you know your own normals, which is going to be high, but now it's really a lot higher, you're able to say, no, this is a lot higher than my normal. So you as caregivers and as patients, of course, you'll probably be feeling pretty ill. It's important for your caregivers to know so that they can be your advocate as well. That's why what's really prompted us to do this guideline is because of this incidence of cholangitis occurring with our patients, and they were traveling and they were misdiagnosed because they weren't being taken care of in their own setting, who were familiar with their disease process. And some patients are too ill to localize the source of infections because they have other types of infections. I don't know if you want to add anything additional to that.
Just the time is of the essence. Time is really important in terms of getting treated quickly and not having to stay in the hospital a long time as a result of that happening. And I'll give you an example. I was caring for an elderly patient who couldn't really localize. She came in, her son told us she had a fever. Her blood pressure was taken, it was low. I knew she had a stent, and so immediately I said, you know what, we're just gonna go right up to the emergency room and get you taken care of. On our way up to the emergency room, she developed Rigers. By the time she was really shaking, by the time we got there, we were able to tell the ED doc. They got an institution with a lot of resources. They got interventional radiology and endoscopy right away. The woman had an endoscopy within a couple of hours, started on IV antibiotics, and 24 hours later, by the next night, went home on oral antibiotics. So reporting symptoms and being clear so that your providers can get an idea of what's going on is so very important.
The other reason this is important is that it's stated in many articles that about 45% of the patients with cholangitis have drains or stents inserted as part of their treatment. And cholangitis could be and is a fairly common side effect of stents and drains. So that's why it's important to know this important infection that can occur as a result of a stent or drain. So really, to be advocates for yourself, caregivers, and patients, really what we would want you to be able to communicate to us, especially if you're not in your own setting, is whether or not you have a biliary drain or stent. Now, how many of you that have had biliary drains or stents, or at least aware of the biliary emergency card that's available from the foundation? Have any? Great. But and that's a very important little card that the foundation that we've developed, actually, in the beginning, Dr. Renuka Iyer, who is our medical advisor on the Nursing Advisory Board, assisted us to develop that biliary emergency card. And it talks about what's the type of stent that you have, how long has it been in there, and that you have one, so that you can present that biliary emergency card to any provider that you may need to see on an emergent basis. The type of stent is very important, whether or not it's plastic or metal. The plastic stents do tend to have a shorter duration of efficacy, 70 to about 120 days. What happens is these stents accumulate microorganisms and bacteria, and they begin to clog up with what they call a sludge. And it's made up of calcium and microorganisms and bacteria. And so that backing up, remember we talked about at the beginning slide, obstruction is one of the key factors of cholangitis. So those stents tend to get clogged up, and you have then the blockage of the stents or the drains that then can cause as well as cause the infection and bacteria. The duration of the placement of stent, usually the metal stents last about 6 months. Not to say that they can't last a little longer, they may last a little shorter. Same thing with the plastic. Sometimes it's 30 days. It depends on the extent of the disease and the blockage in the bile duct system. The drains, what we do find as a sign or symptom of cholangitis, if you've got an external drain, the decrease in drainage. Many of you probably, if you've had drains, you know how much drainage comes out per day. If you had a sudden stoppage or a great decrease in that drainage, that's a sign that there is problems, that there may be a problem, to at least go to your provider to get it checked out. Or if you've got leaking around the drain site is another sign and symptom that needs to be addressed with your provider. The date of your last chemo infusion, as I was talking about earlier, do you usually have a fever post-chemo infusion? Keep track of those last, so that if you are traveling or if you're not in your own provider and you go to the ED and they think that maybe the chemo has caused the fever, knowing what your usual response is to chemo, how high your fever gets if you get one, is also important. And again, do you know your own normal lab values?
So just some takeaway points, some highlights, especially if you're traveling or if you don't live near the center that you treated and you might have to go to a local provider, a local emergency room. The things for you to remember and have the information on are, if you have a biliary stent, what type of stent it is. Is it metal or is it plastic? When was it last changed? And the symptoms, be very clear about the symptoms that you're having. Because this is, again, as we've all heard, it's a rare disease. In the community, a lot of people don't know what they're dealing with. In the ED, they might go to other places on thinking of infection. So please, those three things are going to be so important for you to tell your provider.
So when you go in with these kinds of signs and symptoms, obviously they're going to do what they call imaging. And the ultrasound, depending on where you are, they may do that first. It's the easiest and the fastest imaging type. If you're going into your own institution that's caring for you and they know the extent of your disease, you might go right up to the very last one, which would be the endoscopy, sonography, the EUS. It's the most sensitive. But these are the types of imaging that you would expect to have to find out where that blockage is in order for them to either do some manipulation of the drain or go in there and put another stent in. The ERCP, I don't know, many of you may have had an ERCP already, but this is a very specialized endoscopy that's guided through the duodenum to pass through the bile and the pancreatic ducts. Usually you're under anesthesia for this. They can biopsy the mass. They can remove any gallstones and their sludge. They can place a stent if the bile duct is narrow or obstructed. Anything to add? Okay. So for nursing, what we're teaching nursing for their standard of care for, obviously, is to monitor your vital signs. We talked a little bit earlier about low blood pressure, and of course the lab values. And important for them when they're doing the assessment to know your normal values. What are your normal compared to what they are now? And your normal may be a bit abnormal, as we talked about earlier. The amylase and lipase, your liver function test, the urinalysis and cultures of urine and blood. They're going to monitor for and treat sepsis, obviously the signs of infection. You'll most likely be what they call NPO, meaning nothing by mouth, for your possible imaging tests or your ERCP. We're going to be giving you IV medications, anti-nausea drugs, which is the antiemetics, antibiotics, obviously, and pain medications. We'll be giving you IV fluids. We'll be monitoring what they say eye and nose, which mean all that you intake and all that you output. And so when an internal stent or external biliary drain is placed, we do want to assess if you are having worsening jaundice, the worsening yellowing, assess that the drainage amount, very important, is either decreased or absent. This is a key hallmark of problems. Checking your bilirubin levels and checking your urine output and color. So with that, this was part of, we wanted to get to the key aspects of assessment for our guideline as we publish this for nursing, what the key interventions would be, information that we would want them to teach you, and information that we would want them to be able to care for you competently and confidently. And so, now that you've heard the information, and we know that's a pretty quick presentation, but from their questions, you are very quick studies, a very sophisticated group of patients here. And so we'd like you now to please answer they're the same questions, but after this presentation, please answer those questions now so we can do some comparisons as to where do we need to focus our education more on, maybe stated in a different way, a little bit more clear, we are open to all comments and constructive criticism, if you will.
So please complete your green surveys for us, and thank you very much.
And then just leave your surveys on the table. We will pick them up as you try, now you go to lunch, because I think we're the only thing now standing between you and lunch. Thank you very much for your attention. Yes, we can't?
No, sorry. I was saying no.
Oh, is
If
it,
you've had a stent or just any patient.
any patient can have cholangitis, but what we find is that patients with stents and drains have a bit higher incidence of it.
It's a great question.
Great question, thank you. Yes, another question?
Just a quick question. Have you ever heard of a metal stent that was good for 8 to 10 years?
Yes.
Okay, thank you.
So just a couple things. We're going to do a little bit of catch up because we've gone a little long. So lunch is just served exactly where it was for breakfast, just right through the hallway. We will begin again at 1:30. So you have 45 minutes for lunch and networking. Also, if you are a patient and you are feeling fatigue, if you'd like to go back over to the Marriott, there's also a patient lounge in the main floor of the Marriott. There's a live feed there. There's comfortable chairs for you to sit in. We just want you to be comfortable, but we know you want to be here. But if you feel like you need a little more rest, feel free to go back and rest, and then you can watch at the Marriott. Also, I just wanted to let you know, the biliary emergency information card, the BEIC cards, they will help you fill them out. There's a computer out in the hall. They will help you fill out the information. You give the information. It populates the card. They'll print it out for you. It folds up like a little credit card that you can stick into your wallet. And then if anything like this happens, you have to go to the emergency room, you can just hand that over to them. It has a QR code on it. Tells them exactly how to treat you, exactly what's going on. You don't have to say a word. Just hand them the card. You don't have to remember anything. Okay? We'll see you back here at 1:30.